So, Dr. Sudak, you mentioned that even in short sessions, in maybe 10 minutes or so, that we could have some focused intervention. And you have co-authored a wonderful book to which I will link in my show notes called High Yield Cognitive Behavior Therapy for Brief Sessions, which is exactly about this, which is to use CBT techniques in brief sessions. So what would be an example, maybe if you could give us one or two examples, we can understand how to do this.
Sure. And I would say that the most common one that I give people is something called action prescriptions.
Action prescriptions.
And this essentially entails having somebody who's depressed, who may have just started an antidepressant. And what I will explain fairly briefly is that one of the things that happens to people when they're depressed is that the natural tendency of people when they're depressed is to not want to do anything. And so they will avoid activity. And maybe initially, if that activity seemed too demanding, they'll feel a little bit better. But that the consequence of continuing to avoid that activity is that there's this vicious circle, and their life just gets worse, and they feel worse. Have you noticed that? That's what I'd be asking the patient. And then what I would say is that one of the really critical things we could do to really help you along and get you to feel better sooner would be to really jumpstart your activity a little bit. So I'm wondering if there's just one or two things you could do this week that if you did them, you think they might improve your mood, even if it's just a little bit. I call it moving the needle. It's maybe from a 1 to a 4 or 1 to a 3, because any improvement would be better. And we'll come up with one or two different things. If need be, I've got under my table a series of pleasant events that the person can look at and pick out one or two things. I'll ask them to look at the first 5 to 10, because to look at all of them would take too long and sometimes it overwhelms them.
So if they don't have suggestions,
I've got a list. Right?
Is that something we can post on our website?
You can actually Google it. Just Google Pleasant Events Schedule.
Pleasant Events Schedule.
And you'll get that. And you can also get it for geriatric patients, in Spanish, for kids. They have all different versions of it. It's really fabulous.
Okay.
And so we'll come up with maybe two things. And then I will write that on a prescription pad. And I will say, now let's think about 4 W's to go along with this. Who are you going to do it with? When are you going to do it? Where are you going to do it? And what are you going to be doing? Those are the 4 W's. And so we're going to get that specific.
Yeah.
And then I'm going to sign the prescription. And I'm going to say to the person, what do you think might get in the way?
Anticipate problems.
Troubleshoot that. Like if it's going to be taking a walk, what if it's raining? How are we going to get around that? And then I'm going to say, we're going to check in about this next time and see if it really made a difference. Now that doesn't take very much time.
Right.
But we know that behavioral activation actually works as well as medication.
There's a lot of research on it, yeah.
Right.
Simple but effective.
Exactly. And everybody can do this. When I teach primary care docs about managing depression, I teach them about action prescriptions. And there is something about getting a prescription too.
Yeah.
So that's one really common thing that I'll do.
So the patient is choosing the activity, though. It's not what you would consider
Correct.
pleasant. It's what the patient thinks they might enjoy.
Exactly. Unless, of course, it's a harmful activity, in which case we probably
Right.
would say don't go to the crack house.
Yes.
But so we figure out something that really could, and a simple thing. I mean, one of the things we try to do with this is to figure out something that's just the right size. It's kind of the Goldilocks principle.
Yeah.
So if the activity is too big or seems like it's too difficult, we really try to say, well, maybe we'll try
Something
to consider
doable.
something that's doable, right?
So do you find that the patient, like what proportion of the patients do you find they come back in 2 weeks or 4 weeks, whatever, and they have not done what they said that you were going to do?
So if that happens, there are lots of ways of troubleshooting it. One is to say, I'm wondering if we just picked a big activity. Was it too much to try to do? And find out a little something about why it didn't happen. So did you think about doing it? Did we have a reminder? I often get people, while I'm doing the action prescription, to put a reminder, an alarm in their cell phone and label what they're going to be doing so that they have an auditory reminder of what's going to be happening. Because the patient has to be, in a number of conditions, they have to be motivated to do it, they have to have the opportunity to do it, They have to remember to do it.
Right.
And so you have to be troubleshooting all of that. But I would say that at least 50% and more than 50% of people will engage in that activity and often find that it's very, very helpful for them to do. And that really gets them more involved in the process of doing more things.
What about, like, is this better than, like, because I have often said to patients, like, I want you to do something fun every day. So it's not as structured. I don't tell them a specific thing. So are there pros and cons of saying, I want you to do something fun every day and letting them decide on a daily basis versus planning in advance exactly what they will do?
I actually think that the more specific and written that you are able to put something into the patient's hands, the more likely it is that it's going to be executed. There's actually been some research that writing down whatever it is makes a bigger difference. And so I think that it can be helpful to be more specific.
Thank you. In the next video, I'm going to ask you to please give us another simple technique that we can use in our brief sessions.